How's it going, Modern Manual Therapy viewers? Dr. E here, and I wanted to go over just a real quick way and pain-free way how to mobilize a frozen shoulder without typically stretching the crap out of them like we often do. Typically, they're really sensitive and irritated, especially in the kind of itis phase of the adhesive capsulitis. So, a lot of times what is more of a novel strategy is actually to give the capsule and all the ligaments a little bit of a rest, because they're typically it's so sensitive and there's so much high tone in the area that by slacking everything you usually get a lot more gains than you would by just stretching a typically high tone, very sensitive area. So if you look at the traditional way to mobilize the shoulder, you're going to distract, give a little bit of lateral glide, a little bit inferior glide, and oscillate. But what I do for a frozen shoulder, and again, you can kind of take a baseline, and again, his shoulder isn't frozen, but you're limited in all these directions, and particularly abduction and ER. Instead of actually doing distraction, what I'm going to do is some compression, some internal rotation, and I'm just going to hold the shoulder like that, give a nice compression with my hand, and just compress medially. I'm going to hold that for maybe about, say, 30 to 60 seconds or so. And again, this should be completely pain-free. And then you just give a slow release, so it's like a positional inhibition. And then when you retest, there should be increased range of motion, and then they can kind of load that. And remember that a true frozen shoulder is what we would really classify as a slow responder, so I'm not looking for huge gains, like anything more than 5 to 10 degrees. A lot of times you can reduce threat, reduce sensitivity with this technique, and get the patient repeatedly moving so they could eventually kind of gain their mobility over time. You're looking at, several months to gain anywhere between 80 to 100% of mobility. The pain may go away rapidly because you can always modulate pain rapidly. So the pain is rapid responding, since the motion is not, because true tissue adaptation and changes actually occur over time. So that is my positional inhibition and my pain-free way to mobilize and initially start working on a true frozen shoulder. Until next time, thanks for watching. Subscribe via email. Check out all of our awesome weekly updates, daily updates. Look at edgemobilitysystem.com and check out Modern Manual Therapy on Instagram, Facebook, and YouTube. Have a great day.